All right, today we're going to play medical detective. We're going to peek behind the curtain to see how doctors solve some of the most common and sometimes complex mysteries happening right inside our chests. Problems with our lungs.
So let's say you've got that cough that just won't quit, or maybe you're getting out of breath more easily. How in the world did doctors figure out what's really happening in there? Well, it kicks off this fascinating investigation. Let's follow that journey, starting with the very first tools they use to get a look inside the body.
Okay, so the investigation almost always starts here, with methods that don't involve any cutting or poking. It's all about getting that first glimpse. You can think of it like a detective arriving at a crime scene. They do a quick survey to see what's what and figure out where to focus next.
Now, when it comes to X-rays, doctors have two main ways to use them. There's radiography, which is basically taking a single, static snapshot of your lungs, like a photograph. Then there's radioscopy, which is way more like a live video feed. It lets them watch your lungs and diaphragm move in real time.
And you would be amazed at what a trained eye can spot in a simple X-ray. It can show those classic signs of emphysema, like a diaphragm that's gone flat, or lungs that just look too full of air. They can also spot areas where lung tissue is hardened, or find cavities or fluid where there shouldn't be any.
But, sometimes a flat 2D picture just doesn't cut it, especially if something looks complicated. That's when they bring in the big guns, the CT scan. The best way to think about it is that it takes hundreds of X-ray slices and stacks them all together to build the complete 3D model of your lungs. This is absolutely critical for things like planning a surgery.
So we've gotten a good look from the outside, but what if the real problem is on the inside surfaces of the airways? Well, for the next phase of our investigation, it's time to send in a camera for an inner tour. And they do this with a procedure called a bronchoscopy. It uses this amazing tool, a bronchoscope. Just imagine a super thin, flexible tube with a tiny camera on the end. It's like a tiny explorer sent on a mission right down your windpipe to get a close-up look at everything.
And while it might sound intense, it's actually a really common and straightforward process. First, they numb your airways, so it's comfortable. Then, the scope is gently guided down to explore. It's a well-tolerated procedure that lets doctors not just see the problem, but a lot of times they can start fixing it right then and there.
And this is where the real power of the bronchoscopy comes in. It's not just a camera, it's like a multi-tool. A doctor can spot a tumor, sure, but they can also remove something you accidentally inhaled, drain an abscess, or, and this is huge, collect tiny tissue and fluid samples to send off to the lab for more analysis.
Speaking of the lab, sometimes the biggest clues aren't in the solid stuff you can see, but in the fluids the body is making. You can think of them like coded messages, just waiting for a detective to come along and crack them.
For instance, if fluid starts to build up in the space around the lungs, that's called a pleural effusion. It's a massive red flag. And for a doctor, it immediately raises a critical question. What is this fluid, and why is it here? Because it turns out not all fluid is created equal. It usually falls into two main camps. Transudate is thin, clear, and watery, and it usually points to a circulatory problem, kind of like a leak in the plumbing. But exudate, that's different. It's cloudier, thicker, and it screams inflammation or infection. Figuring out which one it is everything.
So how do you tell them apart? Well, sometimes it's with this beautifully simple, almost old-school test called the rivalta test. You just take a drop of the fluid and put it in some acidified water. If it's the protein-rich exudate, it leaves this cloudy, smoke-like trail as it sinks. If it's transudate, poof, the drop just disappears. So simple, so elegant, and it gives a really fast answer.
Okay, so we've looked at the lung structure, we've analyzed its fluids, but there's one more massive piece to this puzzle. Performance. I mean, it's great to know what they look like, but how well are the lungs actually doing their job? And to measure that performance, doctors use something called spirography. This test is all about turning your breath into cold, hard data. It measures how much air you can move, and just as important, how fast you can move it. And there are two numbers they're really zeroing in on here. The first is your vital capacity. That's the total amount of air you can possibly breathe out after taking the deepest breath you can. The second is FEV1, and that's how much of that air you can blast out in just the first second. So what do they do with these two numbers? Well, they look at the ratio between them, how much air came out in that first second compared to the total. This is called the Tiffinau-Pinelli index. In healthy lungs, you should be able to force out more than 70% of your lungs' total air in that first second. If that number is lower, it's a huge sign that something is blocking your airways. But here's the next question.
Is that blockage permanent, or is it something that can be reversed? To figure that out, they run another test. They measure your FEV1, then they give you a puff of medication called a bronchodilator. It helps open up the airways, and then they measure again. If your score jumps up by more than 15%, that's a massive clue that the obstruction is reversible, a classic sign of asthma.
You see how this all works? No single test gives you the final answer. The real power here, the real diagnostic magic, happens when you start combining all these different pieces of evidence.
It's this beautiful, multi-layered approach. The imaging, your X-rays and CT scans, shows the what and the where. The bronchoscopy gives you that direct look and lets you grab a sample. The fluid analysis decodes the body's secret messages. And finally, the function tests tell you what the real-world impact is on your breathing. You put it all together, and you go from a vague symptom to a precise, actionable diagnosis.
This whole journey, from a simple cough to a full diagnosis, just shows how incredibly powerful our modern medical toolkit has become. It's just amazing how far we've come in our ability to see and understand the complex world inside us. And it really makes you wonder, doesn't it? With technology getting better and better, what mysteries of the human body are we going to solve next?